It's time now for Ask the Surgeon, brought to you by Everett Bone & Joint. Everett Bone & Joint, the best choice to get you back in the game. Learn more at everettboneandjoint.com.
All right, Ask the Surgeon, brought to you by Everett Bone & Joint. Joining us once again, Clay Wertheimer, orthopedic physician from Everett Bone & Joint, and Everett Silvertips team orthopedic physician. We're here to talk about youth hockey injuries.
Clay, how you doing tonight?
Good, Shannon. Good to see you guys.
Well, as you know, you and I are both involved with hockey in town here, and since its inception, you've been the team, or your group, Everyone Joined, has been the team physician. Is that right?
That's true, yeah.
Yeah, so hockey is pretty demanding physically, and it's a pretty rough sport. I mean, there's a lot of contact and a close proximity out there. So tell me, what is your role as a team physician in the hockey? Let's talk about at the hockey game.
Yeah, at the game, we're responsible for taking care of the players, any acute injuries that happen on the ice during the game. So generally, we show up before the game, check with each of the trainers, and make sure there's no issues.
You're taking care of the visiting team also?
Yeah, we're responsible for the visiting team as well. And make sure there's no issues or they have any questions. And then during the game, if any player gets hurt, it's our responsibility to help with their assessment and take care of their injury and hopefully get them back on the ice so they can play right away.
So probably some nights are busier than others?
Oh, yeah. Some nights you just sit there and enjoy the game. We touch base with each team between periods, go down and check with the trainers to see if they have any issues or any players they need to have us look at. And some nights nothing happens, and other nights you're pretty busy.
So tell the listeners and give us kind of a scenario when you go down between periods. I mean, you're in the locker room and guys are coming in and you're looking at them. Does the trainer, the athletic trainer from each prospective team, bring those players to you?
Right. That's who I talk to and interface with. And the trainers for all these teams are really competent guys. They do a great job. They know their athletes, and they know what injuries need to be really paid attention to, and so we have a kind of mutual trust, and I trust them that they're going to bring a player to me that needs to be seen, and if they say everything's okay, everything's okay.
So what is the most common injury you normally see?
Well, hockey is a game played with a bullet, sticks, and knives. Mm-hmm. A bullet is the puck, the sticks are the hockey sticks, and the knives are the blades. So the most common thing I see are cuts. Either from a stick up to the chin or the face or a puck. And so what we call in doctor terms lacerations, cuts that need to be sewn up. That's the most frequent thing that we see during the games. And so our job is to get in there, quickly sew the kids up to close up that wound and put a dressing on it and get them back out there.
Kind of a mash unit downstairs.
And the hockey players is good because I'm an orthopedic surgeon, right? I'm not a plastic surgeon.
Right.
So the hockey players, they don't really care how pretty the scar looks. In fact, kind of the uglier the scar, the better. So that takes some of the pressure off me as an orthopedic surgeon.
Wow.
To sew up there.
So the scar is kind of a warrior mark.
Yeah, right. Yeah, the young guys are always happy to get that first cut. And, okay, doc, sew it up.
I want to get back on the ice.
That's right.
And a lot of those guys go right back out there and play. That's just part of the game.
That is part of the game,
isn't it? I think when you're 15 and younger, you have to wear a full face shield.
That's right.
And then when you're over 15 or 16 and above, you can start wearing the half shield.
Right.
So, a lot of times the puck will go up underneath that shield and the stick, so lacerations are real common. Do you ever have to send anybody? Is there ever a laceration or a cut so bad that you actually do consult or call in a plastic surgeon?
We haven't yet.
Have you?
Knock wood. Knock on wood.
Yeah.
You're mentioning the face shields is really important. I shudder to think what it was like before helmets and face guards.
The goalies never even had masks.
Isn't that amazing?
Yeah.
But I really think, ideally, from my perspective, having full face shields throughout the leagues would be a smart move because they do afford protection. And, the players will say, it screws up our visibility. But the goalies wear full face guards, and who needs to see the puck more than the goalie? So
right.
I'm not sure I'd buy that, but at any rate, I would like to see full face shields for all these young men and women who are playing the game, because I think it would cut down on the cuts and lacerations that we have to sew up.
That's interesting.
I'm not being lazy or anything.
Yeah, right, yeah.
I like sewing up.
Are you getting pretty good at suturing then, aren't you?
Yeah, I'd rather see him not get those.
Exactly. Yeah, there you go. I got it. Hey, so aside from the sutures and lacerations, cuts, if we talk like general musculoskeletal, tendons, bones, ligaments, give me an upper body perspective. What do you see probably the most common injury in hockey?
Yeah, it's interesting. I mean, a lot depends on the position. Mm-hmm. When you look at hockey injuries, the people that get hurt the most are the offensive guys, the guys on the front line.
Going into the corners and in the boards.
I think so, yeah. I think it's the checking that really, and getting slammed on the boards. So those kind of injuries we see upper extremity or AC joint separations, shoulder dislocations and sprains, because they have their stick in their arm and then they get slammed and pulled in weird directions.
So when you say AC joint separation and that crushing check into the boards, and those boards have a lot of give. You see some of those hits and those boards where you rattle around, but still that AC joint, describe anatomically the AC joint so we can kind of get it.
Yeah, right. Well, it's kind of, in football, I think it's called a shoulder pointer, when the player gets tackled onto the turf with their shoulder leading into the ground. The AC joint is the acromioclavicular joint. So it's where your collarbone joins the top of your shoulder blade and forms a joint. It's actually separate from the ball and socket joint of the shoulder, but we kind of think of it as an integral part of how your shoulder works. And so when these players get slammed onto the ice or against the boards, the top of their shoulder hits or strikes that hard surface, and that joint, which holds the collarbone to the shoulder blade, gets stressed. And the joint is held together by these tough fibers, ligaments, and those ligaments get torn. And because of the muscle attachment to the collarbone, it can actually spring the collarbone up or separate the acromioclavicular joint. So that's a fairly common injury that we see from, hockey injury contact.
Now, if someone was going to separate or irritate their AC joint, are they going to feel a pop or immediate pain? It's pretty painful.
Yeah, it is. They may describe a pop, or they'll feel immediate pain, and sometimes they have difficulty lifting their arm. Depending on how bad it is, and it hurts right on top of the shoulder, right where that collarbone joins.
So they can you can actually just touch that and be quite sensitive to what we call palpation or touching.
And most of the injuries are not bad enough that require surgery. They're a sprain similar to a sprained ankle, and they will heal. They need rest and avoiding further contact and stress and strain, and they'll heal on their own. But sometimes when the ligaments are so torn and that collarbone really pops up away from the attachment, then we have to put it back together and reinforce it so it will be stable again.
So a normal AC separation time-wise, are you talking, I think we usually talk 4 to 6 weeks?
Yeah, 4 to 6 weeks. That magic number actually has some science behind it. It takes your body about 6 weeks to make collagen, which is the basic protein building block of all these tissues we talk about on this show, ligaments, tendons, bone. Collagen, this protein, is the basic building block of those tissues. And for the cell to make the collagen takes about 6 weeks to make it and spit it out.
Well, that's interesting. He's like Bill Nye the Science Guy.
I know, it's fantastic. I just want to tell everybody we're talking with Dr. Clay Wertheimer, orthopedic physician from Everett Bone & Joint. This is Ask the Surgeon segment on Health Matters. If you have a question, give us a call, 425-304-1380. I have a quick question for you. Are there different types of injuries in preseason as opposed to the regular season?
That's a great great question. Sorry, injuries on my mind. That's a great question. And I don't know if it's different types, but certainly if you look at the frequency of injuries in hockey specifically occur mostly during games, not practices, mostly in the late periods of games, and mostly early in the season. Earlier in the season and preseason are where injuries occur more often. So that really implies, when you think about that, it means that conditioning has so much to do with injury. There's such a relationship there. And when the athletes are conditioned, when they're not overly fatigued, then their chance of injury is certainly going to be a lot less. When they're totally exhausted, or early in the season when they're not in shape, and when they're not as sharp physically, then they have a greater tendency to get injured. So I don't think it's so much different injuries as it is the frequency of the injuries.
Aren't they in more shape now than they did? Well, maybe we should ask that to the Coach Verity when he's on.
Yeah, we'll bring that up. We'll talk about conditioning.
Yeah.
But, also I think what we see early in the season is more kind of repetitive trauma, overuse, sprains, strains. And then latter part of the season, maybe that's where you see some of the more significant injuries such as MCLs. And let's talk about MCL because I know that occurs a lot in hockey. And describe the MCL. And when we say MCL, what are we talking about?
Yeah, we're talking about the knee, and we're talking about a ligament that holds the knee together. You think about the knee, it's the junction or joint of your thigh bone and shin bone. Kind of works like a hinge, bends back and forth, allows you to run and skate. And that hinge is stabilized by 4 major ligaments or ropes that connect the two bones together. And there's a rope on the inside called the medial collateral ligament, and that really keeps your knee from going too knock-kneed when you're shifting your position or pushing off on a skate. And so that's what gets hurt in an MCL injury, the medial collateral ligament. And oftentimes it occurs when someone gets either tackled or checked and the knee gets pushed inwards, like in that knock-kneed position, the ligament gets stretched, and it can stretch only so much. And if it gets pushed inwards quickly with a lot of force, the ligament will tear.
So that sounds like an injury that you would see a lot in hockey.
It's an injury we do see a lot in hockey and in football. And most contact sports is a very frequent injury. And
also skiing. Again, it's any kind of stress to that inside joint.
That's right, where people are falling. Where you're going pretty fast and you fall, you're liable to hurt your MCL or medial collateral ligament.
Or yourself. Hurt yourself.
or walking on a treadmill.
Don't fall down.
Yeah, exactly. So what is the treatment of that MCL sprain? So when you stretch a ligament, that's a sprain.
Right.
When you tear a tendon or a muscle, we call that a strain. And so when you stretch that ligament or sprain that medial collateral ligament, what is the time frame of healing?
Yeah, the ligament tears as well, but we kind of think of it as in degrees, and orthopedic surgeons are pretty simple-minded guys, so they basically have 3 categories for almost everything in life. And in sprains of the ligaments, we have 3 categories: grade 1, grade 2, grade 3. And grade 1 is kind of a microscopic tear of the ligament. Grade 2 is a partial tear of the ligament, and grade 3, the whole thing's torn. So most MCL sprains are grade 1 to 2. And because the MCL is outside of the knee joint proper, it actually heals. It's not bathed by joint fluid, which could dissolve a clot. So when that ligament tears, it bleeds in there, the blood forms a clot, and the clot forms scaffolding for which the body can make that magic collagen stuff and knit it back together. So typically for a sprain grade 1 to 2, it's somewhere between 4 to 6 weeks. Again, that period of time it takes your body to make that collagen building block and link it up together.
And what about a complete grade 3? Is that surgically repaired?
That's controversial. My feeling on that is that a complete grade 3 tear doesn't really occur isolated. If the knee gets enough trauma to completely tear that medial collateral ligament, then probably one of the other important ligaments inside the knee is torn as well, the ACL or the PCL.
Right.
We are out of time. Dr. Wertheimer, thank you so much once again for joining us on the Ask the Surgeon segment.